Joints of the skeleton. Any connection between bones of the skeleton is called as a joint or articulation. Arthrology is the term applied for the study of joints. Classification of joints. Joints are classified as 1. Fibrous joints. 2. Cartilaginous joints. 3. Synovial joints. Fibrous joints, or synarthroses, they are also called as fixed or immovable joints. In these joints, there is a tight union between the bones. So, no movement is possible at these joints. Example: sutures of the skull and teeth in their sockets. Cartilaginous joints, or amphiarthroses, they are also called as movable joints. In this type, 1. The articular ends of the bones are covered by hyaline cartilage. 2. There is a pad of fibrocartilage between the joint. 3. The joint is covered by ligaments. Symphysis pubis and intervertebral joints are examples of cartilaginous joints. Synovial joints, or diarthroses, they are also called as freely movable joints. The characteristics of these joints are: 1. Articular ends of bones are covered by hyaline cartilage. 2. Bones are bound together by ligaments. 3. Joint is enclosed by fibrous capsule. 4. Capsule of the joint is lined by synovial membrane. 5. The cavity of the joint contains synovial fluid. Classification of synovial joints. Synovial joint is further classified as follows. 1. Gliding joint, plane joint, here two flat surfaces of bones glide on each other. 2. Hinge joint, here, movement is possible in one plane only. 3. Pivot joint, in this joint, rotation is the only possible movement. 4. Ball and socket joint, articulate end of one bone is ball-like. It fits into the socket-like cavity of another bone. Movement in all directions is possible in this type. Example: shoulder joint and hip joint. 5. Condyloid joint, it is similar to hinge joint but movement occurs in two planes. 6. Saddle joint, it has one concave surface. This results in free movement in all directions. Movements occurring at joints. The movements which occur at joints are classified into three major types. 1. Gliding movements. 2. Angular movements. 3. Rotation or circular movements. 5. Condyloid joint, it is similar to hinge joint but movement occurs in two planes. 6. Saddle joint, it has one concave surface. This results in free movement in all directions. Movements occurring at joints. The movements which occur at joints are classified into three major types. 1. Gliding movements. 2. Angular movements. 3. Rotation or circular movements. 4. Abduction, it is the opposite of adduction. Here the limb is drawn away from the midline. Rotation or circular movements, they occur when one bone moves around or within another bone. The movement occurs around a central axis. It is further classified into 1. Medial rotation, which occurs towards medial direction. 2. Lateral rotation, which occurs towards lateral direction. Circumduction is a combination of rotation and angular movements. It involves flexion, abduction, extension, adduction, and some rotation. This movement occurs in shoulder, hip, etc. Joints of upper limb. Sternoclavicular joint, it is a gliding joint between sternum and clavicle. A pad of cartilage is present in the joint cavity between the bones. Acromioclavicular joint, formed by outer end of clavicle articulating with acromion process of scapula. There is a pad of cartilage between the ends of bones. There is a limited amount of movement in all directions. Shoulder joint, it is a ball and socket type of joint. It occurs between head of humerus and glenoid cavity of scapula. The bones are united together by ligaments. These ligaments form a very loose capsule. Also, the shoulder joint has a synovial cavity. The tendon of long head of biceps passes through this. Movements, all types of movements like flexion, extension, abduction, adduction, rotation, and circumduction are possible at this joint. Elbow joint, it is a hinge joint. It is formed by humerus above and radius and ulna below. It is composed of two different joints. They are 1. Humero-ulnar joint formed by trochlear notch of ulna and trochlear surface of humerus. 2. Humero-radial joint formed by head of radius and capitulum of humerus. These four articulating surfaces are covered by a joint capsule. Radio-ulnar joint, this is formed by the articulation of radius and ulna at their upper and lower extremities. The interosseous membrane joins them throughout their shaft. This joint is further classified as 1. Superior radio-ulnar joint formed by head of radius and radial notch of ulna. 2. Inferior radio-ulnar joint formed by head of ulna and lower end of radius. Movements, pronation and supination occur at these joints. Wrist joint, it is a condyloid joint. It is formed by the lower end of radius and three carpal bones, navicular, lunate and triquetral. Movements, flexion, extension, abduction and adduction are the movements which occur at this joint. Metacarpophalangeal joints, they occur between metacarpal and phalangeal bones. The movements at these joints are flexion, extension, adduction and abduction. Interphalangeal joints, they occur between phalangeal bones of the same finger. Flexion and extension are the movements possible. Joints of lower limb. Hip joint, it is a ball and socket type of joint. It occurs between acetabulum of innominate bone and head of femur. The acetabulum is deepened by a ring of fibrocartilage called acetabular labrum. The joint capsule is strengthened by three ligaments. They are 1. Iliofemoral ligament in the front. 2. Pubofemoral ligament below. 3. Sciofemoral ligament at the back. The head of femur is connected to the sides of acetabular notch by means of a ligament. It is called as ligametum teres. Joints of lower limb. Hip joint, it is a ball and socket type of joint. It occurs between acetabulum of innominate bone and head of femur. The acetabulum is deepened by a ring of fibrocartilage called acetabular labrum. The joint capsule is strengthened by three ligaments. They are 1. Iliofemoral ligament in the front. 2. Pubofemoral ligament below. 3. Sciofemoral ligament at the back. The head of femur is connected to the sides of acetabular notch by means of a ligament. It is called as ligametum teres. Movements, flexion and extension occur at knee joint. Ankle joint, it is a hinge joint formed by 1. Tibia and its medial malleolus and lateral malleolus of fibula. Both form a socket. 3. Talus below, which fits into the socket. The capsule of the joint is strengthened by medial and lateral ligaments. Movements 1. Dorsiflexion, bending the foot up towards the leg. 2. Plantar flexion, bending the foot downwards. Joints _of the foot, they are 1. Tarsal joints, they occur between talus and calcaneum and also between other tarsal bones. 2. Tarsometatarsal joints, occur between tarsal and metatarsal bones. 3. Metatarsophalangeal joints, occur between metatarsal and phalangeal bones. 4. Interphalangeal joints, they occur between phalangeal bones themselves. Joint disorders. Arthritis, it is an inflammation occurring at a joint or joints. It can occur at any age but commonly occurs in middle and old age groups. The common type of arthritis are 1. Rheumatoid arthritis. 2. Osteoarthritis. Rheumatoid arthritis, it is a polyarthritis. It is bilateral and symmetrical in distribution. The commonly affected joints are those of hands and feet. In severe cases, most of the synovial joints are involved. The cause for rheumatoid arthritis is not known. It is an autoimmune disease initiated by microbial infection, probably viruses. As the disease progresses, it leads to intermittent fever. Later, there is deformity of joint leading to decrease in movement and pain. Steroids are usually given to treat this condition. Osteoarthritis. It is a disease occurring due to degenerative changes in the cartilages of joints. The articular cartilage becomes thinner, so the articular surfaces of bones come in contact with each other. Later the bones start degenerating. This produces pain, stiffness, and decrease in movement. Physiotherapy and reduction in body weight are advised in this condition. Also, steroids are beneficial. Gout. It is caused by the deposition of sodium urate crystals in joints and tendons. It occurs in people with high uric acid levels due to overproduction or decreased excretion by the kidneys. There is arthritis, lasting for several days or weeks with some remission in between. After repeated attacks, permanent damage may occur. Joints commonly affected are ankle, wrist, knee, and elbow. Shoulder joint. T is more liable for dislocation than any other joint because of 1. Shallow articulating cavity. 2. Large size of the head of humerus. 3. Laxity of the capsular ligament. Dislocation of shoulder joint may complicate fractures of upper extremity of humerus. Sternoclavicular joint. A forward or backward dislocation may occur as a result of a heavy fall on the shoulder. Elbow joint. Backward dislocation can occur at elbow joint. It may be accompanied by fracture of the coronoid process. Hip joint. Dislocation of hip joint may occur in any direction, but backward and medial dislocation is more common since the capsule is weak at these sites. Knee joint. Knee joint is surrounded by strong ligaments and powerful muscles, so it is one of the strongest and most stable joints in the body. So dislocation of knee joint is very rare. But the following disorders may occur at knee joint. 1. Slipped cartilage. It occurs due to tearing, detachment or displacement of one of the semilunar cartilages of knee joint. 2. Acute synovitis. It may occur at knee joint due to trauma. Since the synovial membrane of the knee joint is extensive, swelling occurs on each side above the patella. 3. Bursitis. Enlargement and inflammation of one of the bursae may occur. The bursa between patella and skin is mostly affected.